Hi, everyone. Good afternoon. It's my real honor to be here today for our second lecture in our seminar series focused on policing and health. This, again, is the second of a three-part series. And we do have today, of course, Dr. Lisa Bowleg, but our third one will be Dr. Bridgette Davis. December 15th, she'll be speaking from 11 a.m. to 12:30 p.m. And she'll be talking about law enforcement and judicial related revenue as a determinant of population health. She's worked with us in the past, was a student at the Yale School of Public Health, so we're really looking forward to that last talk in our series. Registration for that will also be included in the chat, and we're really excited to have all of you here with us for our last talk, this talk, and then hopefully Bridgette's talk as well. New again to the fall seminar series, we've been really trying to explore both important scientific questions and also get to know our speakers a little bit more about what drives them in their science, what motivates them to continue doing this work, and also pushing ourselves in this process and learning kind of about the processes of science and also the questions that are being asked. And so we welcome questions throughout the seminar. Questions can be submitted through the usual Q&A. They'll be addressed throughout and at the end. And I think we'll have time. We've hopefully extended a little bit to an hour and a half now so that you can actually ask your question live by raising your hand, and we'll unmute you briefly. The presentation will be recorded and distributed afterwards to anyone that's registered. And I wanted to thank our co-sponsors. We just have a real vibrant community at Yale that was really excited about this talk here that Dr. Bowleg is presenting. So this talk is co-sponsored by the Center for Policing Equity, the Equity Research Innovation Center at Yale, the Center for Interdisciplinary Research on AIDS at Yale, and the Department of Social and Behavioral Sciences at the Yale School of Public Health, all of whom are partners with our SEICHE Center. All right, so we're going to go ahead and get started. And I really hate it when people read full bios, but I just feel like I am still going to honor Dr. Bowleg. So I'll abbreviate a little bit of here, but just to really highlight that Lisa Bowleg, PhD, is a professor of applied social psychology in the Department of Psychological and Brain Sciences at George Washington University, GW. And she's also the director of the Social and Behavioral Sciences Core at the DC Center for AIDS Research. She's the founding director of two new intersectionality institutes that are launching this year, if they haven't already launched, and we're going to ask her a little bit about this. And in particular, are providing training and workshops on the application of intersectionality to research. So qualitative, quantitative, and mixed methods, as well as the policy and practice. So really kind of the integration of research as it applies to policy and practice. She's a leading scholar of the application of intersectionality to social and behavioral science research, and of course is informed by critical frameworks such as intersectionality and critical race theory. In particular, I think what's been exciting for me to explore through her work is a mixed methods, use of mixed methods research to explore social structural stressors, especially unemployment, police brutality, and incarceration. And it's here, I think, that we are going to be illuminated and really educated for the next hour. She has served as a principal investigator of multiple National Institutes of Health Studies, an associate editor at AJPH, an editor specifically at AJPH's Perspectives from the Social Sciences section, and has been awarded a number of national awards, really signaling kind of her leadership in this area. And so I'm going to start today by just with a couple of questions that, I'll take the opportunity as a moderator to say that I had the chance to re-familiarize myself with your work, Lisa. And one of the things that I think I'm most interested in, and our center is really interested in, is specifically what motivates you to do this work. It isn't easy. It's really kind of at the, I think, kind of transforming how it is that we look at these complex issues like intersectionality. And in particular, and I don't know how many in the audience have read this, but I just reread, read and then reread again Sex Roles in 2008, when Black plus lesbian plus women doesn't equal Black lesbian women, methodological challenges for qualitative and quantitative intersectionality research. And this article in particular, I think, speaks to something that I've seen throughout your career of where you really bring your authentic self into your kind of intellectual inquiry on how you measure intersectionality. And, you know, many scientists will go through this process, but won't write about it or actually speak to kind of, oh, I messed up here, and this is what I did wrong in this study, and then this is how we should apply it forward. So I just wonder if you could speak to that kind of practice of science and how it is that you bring kind of your most authentic self to this work.
I can, but first I want to thank you for the invitation to you and Tyler Harvey. It seems like we started talking about this ages ago, right? And, yeah, and here we are. So I'm just delighted to be here. So thank you first and foremost. Well, to answer your first question, what motivates me? I'm very much motivated by injustice, and I'm impatient. I find myself just getting increasingly impatient with the role of research in injustice. And, you know, a lot of times I think, oh my God, do we really need another study to tell us that racial discrimination is bad? And here are the ways that I think we're falling short of the science. And so that's what I'm always trying to do, right? Trying to push the field. Like, I think we need to get more structural. We need more structural approaches. We need more qualitative and mixed methods approaches. We need more community engaged approaches. I see very much that a lot of the sort of conventional, traditional approaches are not getting us where we need to go. So that a lot of my motivation comes from that. In terms of the authenticity and that you see in my work, and I love that. I love that it comes across. I'm very much in the tradition of a qualitative researcher, in the sense that one of the things that qualitative researchers really prize is reflexivity. And this reflexivity is integral to all types of research, whether it's quantitative, qualitative, but, you know, qualitative people are much more upfront about it, which is this notion that who I am, you know, sort of my values, my identities, my upbringing, my training, all of that informs the science. And part of that is being really upfront about that there's a person behind this science. I mean, so much of us are trained in this notion, in this sort of post-positivist tradition where, you know, scientists are supposed to be objective,
Yeah.
and, right? And we see many ways where science is anything but objective. And so what I'm always doing is just really being really clear. Okay, here's the interpretation I made. Here's the mistake I made. Here's what I tried and didn't work. And I think that's a really sort of richer way to do science. I mean, don't you always want to know, like, oh, I often want to know about, okay, what didn't work? Yeah, this looks really great in this this article I'm reading, and everything looks like it worked sequentially and linearly, but in my experience, that's not how science works. And so that's just sort of part of my commitment to being authentic as what it means to be a social and behavioral research scientist.
Yeah, I think part of what I appreciate about that, so I totally hear you, which is that as a qualitative kind of researcher, and I wouldn't label you as such, though I can see kind of, again, where the practice of your research is really informed by that part of you that does engage in qualitative research. It does make sense, right? That reflexivity component is really critical to qualitative research. I think what I have a real appreciation for is that you aren't just a qualitative researcher, you are mixed methods. You do, you know, really kind of, there's parts of your work that are very quantitative, and it's in that measurement, I think, piece that you incorporate in parts of being a scientist that I think are really critical. I mean, you ask, it does strike me as like, you know, the very questions you ask are also really grounded in the person that you are, and and to pretend that it's a fully objective science that's not informed by the experiences that you've had, that you've lived, I think is disingenuous, and it comes out in your writing. And so I think that that's in particular something that strikes me as important. Is there a formalized practice that you have with this, or is this just something that you specific tools that you've baked in, or ways that you?
No, these are just things that I think are really important, and that I teach the qualitative class at GW, and things that these are messages that I try to impart to my students. Like, so for example, the passive voice in writing, I just can't stand it. I find it so problematic, but it's such a tool of science, right? This notion of using the passive voice as a veneer of objectivity. And so I really encourage, no, the data were not analyzed. You analyzed them. Who analyzed them? And taking responsibility for the choices that we make as scientists. And so I'm very much committed to that. And that comes across in the language that I use. You will very rarely find, unless I've been forced to by a journal, doing passive voice. It's always I, we, these decisions that we made. And I think that's really, really important. It's really important. And so there's nothing, there's nothing formal about it. It's just something, but I've heard now, I've been doing this for a while. And so it's now clear to me, like, oh, okay, I do have a voice. And this sort of, people say often, this authentic voice in the way that I write. And that was just, I didn't know any other way to do it. And I was not satisfied with the conventional, that wasn't going to work with me.
Yeah, I appreciate that. The other question I have for you is that, again, as far as I know, that there aren't any other centers focused on intersectionality. So I would love to hear a little bit more about kind of plans for the center, what it is that you're planning to launch, or what it is that you've already launched.
I have already launched. It launched last Wednesday, officially, last Wednesday night. So it's been a busy week. Yeah, so I want to, if I may, direct the audience members to go to the Intersectionality Training Institute. And so you'll either find it with using quotes, or it's just www.intersectionalitytraining.org. This is it's really a passion project. So as you might imagine, my inbox is just filled with people asking questions about doing intersectionality work and how do you do this? And I also have the privilege, since I'm an NIH funded researcher with several intersectionality projects, I'm in these sort of circles hearing about how people are talking about it. And it was quite clear to me that there was a lot of what we call flattening, meaning intersectionality scholars mean the ways that as intersectionality has gotten more mainstream, this attention to power and all of that has gotten stripped away from it. And so it gets flattened to multiple identities, which makes no sense. Everybody has a multiple identity. And it's really being stripped of that sort of structural piece. And so I decided that there was a real need for training. And so along with Greta Bauer, who is the quantitative intersectionality guru, we've been collaborating for a long time, and we've launched this institute, and we're going to be doing some really cool things. So one of the things we're going to do is a monthly, starting in January, we're going to have these intersectionality research salons. These are not webinars. These are not lecture series. And I see it's in the chat. We're going to invite people to bring a beverage, and we're going to have hosts to really sort of talk about intersectionality research. And we want this to be really interactive. And so we're going to have different guests who are going to talk about, maybe 5-10 minutes, what they're working on, what they're grappling with, but then really just talk about all of the sort of challenges of doing intersectionality work. We are going to offer a in-person summer intensive next summer in July in Philadelphia, where people will come and spend 5 days doing a deep dive into quantitative, qualitative, and policy practice intersectionality stuff. And we're doing webinars and seminars and workshops and all kinds of exciting stuff that I'm really just thrilled about.
That's amazing. With some of the work that I've been doing recently, it's interesting to, in criminal legal systems, oftentimes there's not even a measurement of race or ethnicity, much less kind of the ability to really kind of understand these, I think, profounder domains of intersectionality and the power dynamics that are laid out, there's not even capturing of gender, right, in a lot of the work that we do. And so to me, I'm really excited for your talk today. We're going to shift over to your talk to really think about how it is that these kind of, I think broadly, because that flattening that you talk about is a real thing, right? Which is like now it's becoming kind of catchy to talk about intersectionality. They're like, oh yeah, I measured it. Like I've got all those three, and so I'm appreciative of this opportunity. Again, remind the group that if there's questions to please go ahead and ask them away, and then I'll help you look over the questions and make certain that we kind of save time at the end for questions that emerge.
Terrific.
All right, without further ado.
All right, so shall I start sharing? Let's see.
Please do.
Sure. Okay, can you see that? All right, so I always say about my titles, I've never met a short title that I like, which is how you get to see all these like long titles of mine. Let me just start my timer here. So what I'm gonna talk about today is how it is that an HIV prevention researcher, which is what I am, I've been doing research on HIV in Black communities predominantly, but also mostly with Black heterosexual men, and how I go from HIV prevention to work in policing. I want to talk to you a little bit about that journey and what I've learned from that research about policing and how it is that I've sort of found myself doing research and talking more about police brutality. So,
Lisa, we're seeing the presenter view.
That's not what I want you to see. Thank you for letting me know. Let me stop this. Let me try again. Okay, I think this is why. And now? Okay, great, all right. Okay, so the roadmap, where we're going, a little bit about police brutality, a general overview, and then I'm going to talk about the critical frameworks that are just so central to my research and in fact, sort of my trajectory in terms of where I started doing HIV prevention research and then sort of where I am now as a result of using these critical frameworks. Then I'm going to talk about the transition, basically how we get from condoms, which is what that's the focus of a lot of HIV prevention research, to police brutality. And then I'm going to show you just some snapshots from our research that inform what we're going to do. And then I'm going to conclude with 4 takeaways and then entertain your questions and comments. So police brutality, we use this term because when we think about police brutality, we want this really expansive term. And we found that police violence is a little too narrow. Also, violence is sort of inherent to the job, that's sort of built in. And so we use Freeman's definition, which talks about police brutality encompassing physical, psychological, and legal police abuse and authority. And Freeman talks about this term more accurately capturing the whole continuum of wrenching experiences many people have with the police. And so I'm going to sort of talk about, as we go on, some of the work that we've done about this continuum and why I think it's so important for us to be thinking about police brutality as an entire spectrum that affects mental and physical health, and what we lose if we just focus on lethal police brutality. So, as you all know, that the Washington Post has a Fatal Force project. It's been sort of collecting data on police violence, and they find that roughly 1,000 people a year are killed by police. And it's important to realize that, media companies like the Washington Post and the Guardian have been collecting data on police violence because police departments have been reluctant to do it. The data of police brutality or violence at the federal level, same thing. There have been so many holes and gaps. And so a lot of this is sort of open source data collection that that papers such as the Washington Post are doing. And so the research shows, surprise, surprise, that Black people are killed by the police at least 2 times more often than are white Americans. And at that intersection of racial group and gender, we see that Black males in particular are something like 95% more, account for 95% of police killings. But the data is so undercounted. So there's so much stuff we don't know. This is a 2020 study published in the Lancet that showed that they looked at data from the National Vital Statistics System and found that it was more than 50% of all the deaths from 1980 to 2018 were unreported, right? There's just not reported as police violence in the medical examiners' reports. And so there's so much that we don't know. The other issue is that because when people think about police violence, they think just primarily about Black cisgender men. A lot of the work that we've been doing in our writing about police brutality is really bringing this intersectional lens that talks about police brutality experienced by cisgender and transgender women. And we saw this in the Breonna Taylor case that, you know, the Washington Post with this intersectional headline. But what we don't know much about is about violence against trans people, for example, police violence against trans people. And of course, Kimberly Crenshaw's group, the African American Policy Forum, has been so amazing in this space in terms of calling attention to police brutality as an intersectional issue, particularly with looking at all of the ways that Black and Latino, cisgender and trans women in particular are just obscured from this sort of single axis focus on police violence as just, you know, something that affects African Americans in general, but not at particular intersections. It's also important for us when we think about police violence to think about this as something that affects populations far beyond those who directly experience police brutality. So thinking about police violence and its vicarious effect. And this slide is really interesting because this came out in June 12, 2020. So this is right in the beginning of the pandemic. And as part of the US Household Pulse survey, that they did the survey because they wanted to understand how Americans were faring with COVID. And what they found was this uptick in depression and anxiety for Black people. And this was they took the measurement in the direct aftermath after the video was released. And they found that Black people had the sharpest uptick in experiences of depression and anxiety from 36% to 41%. And then the other group that also saw a spike in depression and anxiety were Asian Americans from 28% to 34%. Because of course, what's going on in this time period is all of the sort of racist backlash against Asian people and Asian American people. And so again, it's important for us to think about police brutality as this thing that affects whole groups of people, regardless of whether or not they've experienced it or not. And I want to point out that as an intersectionality scholar, this is typically how data is represented, right? At the single axis. So it's just the whole group, but we rarely know about intersections within it. And so in my work as an intersectionality scholar, I'm very much interested in looking at, well, who's invisible? Who are we missing? Who's falling through the cracks when we use what's called a single axis lens? So just one, and you know, it's usually like race or gender, rather than an intersectional lens that is very much concerned with looking at intersections across at the intersection of racism and sexism and cisgenderism and so on and so forth. So I want to talk a little bit about critical frameworks, because this has been sort of central to our work and how we've gotten here. So these are just, you know, the traditional types of health behavior theories that people typically learn in undergrad or grad school. And I see these as important, but sort of limited for understanding health inequities, which is one of the things I'm interested in, generally speaking. One of the problems, there are many problems with these, but one of the problems is that they presume that health is a property of the individual rather than factors beyond the level of the individual that shape kind of everything, right? And they also are primarily cognitive, what people think, believe, attitudes. And so health has sort of been distilled to that. And so initially, this is where I started as an HIV prevention researcher. So for example, we included measures of condom self-efficacy, this perception of your conviction to engage in safer sex behavior. But our research, because we often, well, not often, always include qualitative components where we do individual interviews and focus groups, showed us that there were so many factors beyond this narrow emphasis on what people think, believe, perceive about their health. And so it became very clear to us that we needed to think about these sort of structural perspectives. And so structural racism is a factor that features pretty prominently as a framework that shapes everything we do on my research team. And this is a 2017 article by Bailey et al. And this definition of structural racism is really important because they talk about it as this sort of totality of ways that societies foster racial discrimination via mutually reinforcing inequitable systems. So what housing, employment, earnings, wage gap, you name it. And that this is reflected in our history and our culture and interconnected institutions. This perspective has been very important to me as a social psychologist, because as a social psychologist, one of the limitations of social psychology is the individual is the primary unit of analysis, right? And so we're very much interested in these individual level experiences and defining discrimination only as something that happens between individuals versus this whole sort of structural perspective, which is embodied in a definition like structural racism. So structural racism, strangely enough, I just wrote an article yesterday that structural racism has been pretty much absent from social determinant of health frameworks, right? It's not even included. And so what I'm showing you here is that as the field is gaining momentum with this more attention to structural racism, you have people like Yerby in this really excellent article that are talking about bringing structural racism to the fore of social determinants of health frameworks as a fundamental root cause. And so this notion is very much sort of present in how we view the work that we do with Black men in the context of HIV prevention, condom use, and raising awareness about HIV risk. This notion that structural racism is sort of foundational to everything that we do. The other frameworks that have been really pivotal to our work is sort of Kim Blankenship's work around social structural approaches. And Kim's a sociologist and one of my colleagues at the DC Center for AIDS Research. And so she talks about these structural approaches that locate the source of public health problems, not just in individuals, but in factors beyond the level of the individual that can sort of constrain the ability of people to engage in health transforming behaviors, or health promoting behaviors. And so you'll hear me use this language quite a bit about social structural, and that's sort of what I mean, factors beyond the level of the individual. So as for critical frameworks, when we're talking about critical frameworks, these are basically just sort of general paradigms, ways of looking at the world that interrogate, expose, and challenge assumptions primarily about power and privilege and their function and how they really serve to facilitate structural inequality. And so there are a bunch of critical theories of intersectionality is just one, queer theory, critical race, but all of these factor into the work we do. So I I've just come to learn in the last few years that I've been acting as a critical psychologist. Who knew? That in and of itself is revelatory, that most people doing psychology today don't even know about critical psychology. So much of it comes out of the UK, but I very much define myself as, now see myself as a critical psychologist as well, not just a social psychologist, but a critical psychologist. And so in line with that definition that I just showed you about power and interrogating power, critical psychology aims to identify and reveal these sort of ideological messages and practices that direct our attention away from power and privilege. And if we look at a lot of the history of, traditional psychology, power is not there at all. It's about this individual and their beliefs and what they did, and what they think. But these notion of things beyond the level of the individual, rooted in systems of power and systems of inequality, have historically been absent from traditional psychological work. So of course, critical race theory is central to our work. This notion that racism is not just this sort of rare, anomalous, aberrant thing, but it's a sort of routine, built-in, mundane, fixed fact of life for Black and other people of color in the US. And this is something that our research has borne out over and over, and I'll show you what that looks like. Intersectionality, of course, intersectionality is this critical, comes out of critical race. And there's sort of two lineages. There's critical legal studies with Kimberly Crenshaw's work. And Kimberly Crenshaw was a brilliant mind behind this term intersectionality. And also at the same time in sociology, Patricia Hill Collins writing a lot about this sort of this intermingling of individual and macro level experiences. And so the definition that I advanced in a 2012 paper titled "The Problem with the Phrase Women and Minorities, Intersectionality, an Important Theoretical Framework for Public Health," really reflects a lot of sort of Patricia Hill Collins's notion, this notion that one, these multiple intersectional positions. I've been veering away more from using the word identities for a number of reasons. I can talk about that in the Q&A if you're interested. I've been talking about them more as intersectional positions, but that these historically marginalized intersectional positions and experiences at the individual level, so what people might tell you in an interview, reflect larger systems of interlocking inequality at the macro level. So they really reflect the intersections of sexism and racism and heterosexism, and that these are sort of foundational macro level processes. But the thing to remember about intersectionality is not just about intersecting identities or multiple identities. I've been saying increasingly, everybody's got a multiple identity. That ain't it. It really is about this attention to power. And this is this wonderful 2013 article by Crenshaw, Cho, and Leslie McCall, where what they say in this article is, look, it doesn't matter whether the work is using intersectionality or not. What makes an analysis intersectional, whatever field it comes out, whatever discipline, is really this attention to power. And so I say often when I talk about intersectionality, if you're not focusing on power and privilege, you're not doing intersectionality. It's really about these interlocking social processes that are based on these intersectional positions, but it's fundamentally about interlocking systems such as racism, sexism, heterosexism, and such. So now I want to transition a little bit and show you what I'm calling from condoms to brutality. Like, how is it that somebody who started off doing HIV prevention work is now talking about police brutality? These are some of my HIV prevention studies. What unites all of these studies is that Black men have been the focus of them, and all of them, every last one of them have involved mixed methods research. And what mixed methods studies seek to do is capitalize on the advantages of qualitative and quantitative methods within a single study. So generally we start with qualitative, might be interviews, might be focus groups, where we talk to people because we're really trying to get a culturally grounded understanding of what their experiences are. And this is important, and I'm going to focus on 3 of these studies and tell you about each when I get there. The Represent study, Manhood and Strengths and Stressors. What's important about our approach is this is the stuff that we get funded to do, right? This is what HIV prevention researchers are interested in. Boosting HIV testing. We want to increase condom use. We want people to know about their HIV status. We want them to be aware. And increasingly, we want people to take PrEP to reduce exposure, right? But when we have talked to participants using the interviews and focus groups, these are the things that the men in our study talk about over and over. They talk about unemployment. They talk about criminal records. They talk about the link between unemployment and having a criminal record. And over, we've done studies in Philadelphia, we've done studies in DC. The police come up, whether we ask direct questions about it or not. And so as an example, this was a first NIH study that I did back in 2010. And what we wanted to know about in this study is we wanted to know about how things related to sort of masculinity, self-efficacy, things. We wanted to know about resilience a little bit, but we wanted to know how all of these things were related to men's condom use behaviors, and we're at sex with multiple partners. And so as part of this, the first part we did individual interviews, and these were with heterosexual identified men, I think between the ages of 18 and 44 in Philadelphia. And then we also did focus groups, and then we developed measures. We do this in my research quite a bit. We develop measures based on what we've learned from the qualitative work. And this is an example of a theme that came up from the focus groups, this notion of having lots of stress, and I've been trying to find a job, and every time I get a job, within 6 or 3 months, I'm let go of that job because of my criminal record, something that happened 13 or 14 years ago. And so it was sort of narratives like this that sort of cued us into, wait a minute, we're losing a whole lot of understanding what it means to be a Black man, particularly a low-income Black man in a place like Philadelphia, if we don't ground our measures in what they're telling us matters, not all that other stuff that we got funded to do about the condoms. Yeah, that's important too. But what can we learn about the larger context of men's lives that might better inform HIV prevention interventions? And so that led to our second study, which was manhood. And for manhood, what we wanted to do, again, in line with this notion of going beyond the level of the individual, we wanted to understand how factors at the neighborhood level sort of impacted factors or sort of interacted, for lack of a better term, with individual level factors to explain why people might engage in more risk. And so we're very much interested in sort of social structural stressors. And when we're talking about stressors, social structural stressors, we're talking about unemployment, the stuff I just showed you about, incarceration, poverty, all of that. We also wanted to know, like, what was protective in neighborhoods? We knew it wasn't money, but we're always interested in, like, okay, what can sort of buffer against risk? And then below this are all the individual level factors. And so, as I said before, we always have, a qualitative part of the study. And so we did these focus groups in 9 different areas that we selected. I'll spare you all of the drama of that process. And then we developed measures. We also used a lot of validated measures, and we collected data from 891 Black men. And so how we got to police for this one study is we didn't ask a single question about the police. We instead asked in these focus groups really sort of general questions, like, tell me about your neighborhood. And if I came to your neighborhood, what kinds of things might we see? And then we also asked, like, on your list of priorities, like all the things that you're dealing with, where does HIV rank on that list? And this is sort of a snapshot of what we got. It's several of the focus groups, right? And so the question the facilitator asks is, how high is HIV prevention on your list? And the participants in this group is like, in my data line, it's like number 9, like number 9 out of a scale of 10. Another respondent says, it's not on it at all. And so then this other respondent sort of goes in to give us sort of this detail of what they mean about, you know, what is on their list of priorities. And you can see Saunders, violent cop, but you can't see HIV. The police is at the forefront of what's going down here 24 hours a day. You can't see AIDS coming. You can't see the AIDS coming, and you focus on what you're dealing with, your surroundings. And so seeing that the police come up over and over made us think like, wait a minute, we are missing a critical part of Black men's experiences within the context of HIV if we don't understand better what it means to be dealing with police all day long. And I should say that, so this Menhood was done in DC, but when we went back and we looked at the transcripts of Philadelphia, we also could see in different focus groups, men talking about violent cops, like, oh yeah, you know him? I mean, so it seems like everybody had a Saunders. So that told us that, okay, wait, this is really important. So what we did is we developed and validated measures of what we're calling negative police experiences. And again, everything was based on what we learned. And we're, you know, the stuff about police jumping out and asking you for ID. Men had stories about being outside their, you know, grandmother's house, talking to other friends. Here come the police. And we tested them, and we see that these were really reliable measures of negative police experiences. And I should just add, we didn't ask any questions about violence. This is just all of the harassment, stop and frisk stuff. And then we also decided that it was important to develop measures about avoiding the police based on things that participants were saying they did, trying to avoid police, like, you know, watching how they drive, changing how they dress, that kind of thing. And we also found that the Cronbach's alpha for this one was a decent value at 0.88. So here is just an overview of the demographics of this sample from one of the papers that we did. And what I direct your attention to is in line with what I was saying about the link between incarceration and unemployment. You will see that almost half, 49% of the participants, of the 891 participants who said that they were currently unemployed, had a history of incarceration. So here is the model we tested. We wanted to know what was the link between having an incarceration history, a record of incarceration, and depression, and how did these sort of negative police encounters and police avoidance, how were they associated with this? And so, and we also had unemployment as a moderator, given the link between incarceration. And what we found were significant direct effects between the effects of having an incarceration history over here on depression and the way it was routed through negative police encounters and police avoidance. So that was sort of the pathway that those who had more negative police encounters and reported more police avoidance, that was the path that explained the relationship between incarceration history and depression. And we also found that unemployment moderated the indirect effect via police avoidance, but not negative encounters. And that kind of makes sense, right? Because men who would be unemployed and have a criminal record are doing their damnedest to make sure that they don't engage, that they don't run into police, right? And so that also is linked to depression. And one of the ways that we hypothesize that it could be linked is that because staying at home to try and avoid the police cuts you off from the very types of social support you need to boost your mental health. And we, as I said, we found that unemployed men with history of incarceration reported engaging much more police avoidance and more depression. In some other analyses, we sought to understand about the psychosocial effects of gentrification. DC is one of these places where gentrification is just off the charts. And so we looked at the qualitative data that men talked about, that experience of gentrification, and surprise, surprise, police surveillance was all over that. They talked about two types of discriminatory experiences. One was this notion of being constantly under surveillance. And this is a quote: "We can't even chill on our front porch. You can't smoke a cigarette without getting harassed by police." And this was especially true in neighborhoods with higher gentrification. And then the other thing related to this is this notion of this differential policing and all the ways that the police were responsive to the needs and concerns of white residents, but not Black people. And so this is just, the white neighbors will call the police if it's more than 3 or 4 of us. This comes up in our transcripts all the time, by the way. This notion of men telling us that if there's 3 or 4 of them just standing around, here come the police, chilling and talking, but the white people be having their parties too, and nobody calls them. And so the police will pass the white people and come and stop and jump out on us. And so this came up over and over again. So after this paper, our next step was this. This is the paper I described, that if this doesn't get us kicked out of the American Psychological Association, nothing will. So this paper was accepted for publication back in August, and we still don't know when it's coming out. And so what this is we basically took all of our sort of passion and our sort of anger for how the American Psychological Association has failed to critically engage. And remember, when I'm talking about critical engagement, I'm talking about exposing and challenging power and privilege in their response to anti-Black police brutality. So this is a really hard-hitting, critical paper. I can't wait for this to be published. That's what I say now until, I'm being like, tracked by racist trolls, but that's, I can deal with that one. And so a little bit about this paper. So I want to go back, the title of it is Beyond Heartfelt Condolences, a critical take on mainstream psychology's responses to anti-Black police brutality. And we came up with that title because we looked at what the American Psychological Association was saying about police violence. And what we found was, whereas other organizations like the American Public Health Association were coming out with these hard-hitting statements, like police violence is racism and a public health emergency, we got from American Psychological Association, the first paragraph is they're expressing heartfelt condolences to the Brown family. This was in the wake of the shooting death of Michael Brown. And that's important, but it was really absent this sort of critical notion of police brutality as a tool of structural racism. And so if we look at how psychology has generally dealt with this issue, it's looked at police brutality as sort of deviant. This is how you get the rogue officers or, something that's aberrant. And a lot of the research is focused on these sort of individual-based variables, like, implicit bias. And so a lot of psychology is focused on, racist stereotypes and implicit bias. This is really important. How things like judgments about Black men's size, this is how you get the thing like, oh, they were so strong. They had this sort of superhuman strength. And in decisions to shoot suspects, how public perceptions and attributions about racist police bias shapes judgments or attitudes. But we found very little about the experience of police violence from the perspective of Black communities. And that's one of the gaps we wanted to fill. We also found increasingly, particularly in a lot of Philip Atiba Goff's excellent work on the role of situational factors such as discretion and experience and the salience of the link between Blackness and crime. And this is important because this really represents a sort of a shift from this just individual level focus on the factors that are involved in police brutality. And so as an example, this is a really wonderful paper about these sort of situational factors. And what Pryor et al. Say in this paper is that, well, social psychology has always focused on situational factors, right, that shape individual behavior. And that these individual level factors are really weak predictors. So focusing on, whether or not police officers have implicit bias, these are really weak predictors of racially disparate behavior, and weak compared to situational factors that tell us so much more, and that we really need to focus on these sort of structural level factors. For example, one is quotas, right? Quotas, police needing to make up their coffers, the notion that they often go in low income neighborhoods to do ticketing, to meet ticketing quotas. These are sort of these type of structural factors that probably tell us more about police brutality and the encounters that people have with police than just these sort of implicit biases. And so, this is just a snapshot of showing you of where American Psychological Association is still very much in looking at this issue as an individual, on these sort of individual level factors. So with the exception of number 2, that banning chokeholds and strangleholds, you'll see that a lot of these recommendations are, increasing the number of mental health professionals. That's not likely to stop police brutality. Involving psychologists in multidisciplinary teams, community policing, something that is really contested in a lot of low-income Black communities, who feel like they're being, in fact, hyper-policed, about having police in their communities. And so that paper really is one in which we really take APA to task. I wanted to highlight another thing that we talk about in that paper that I think is really important. And it's this notion that we should really think about police brutality as a continuum. Typically, we focus on the end, right? The lethal, the acts of police brutality or violence that end in death. And those are critically important, no doubt. But what we argue in this article is there's a whole spectrum of things usually that happen that are antecedents to the lethal stuff, right? The being pulled over, the ridicule, the stop and frisk. We think of this the Sandra Bland case, for example. She's being pulled over by a cop that sort of quickly escalates by the police officer, and ends up with her dying in a way that's contested by her family. The law enforcement in Texas said that she took her own life, and this is something that her family is disputed. And so one of the things that we are trying to do in our work is say that we need to think about this as a larger spectrum of all of the ways that structural racism sort of manifest in police brutality, that explains all of the contacts that people have with police before a lethal encounter. So just quickly, I want to show you about how we're doing this in a current study. This is strengths and stressors. It's not an HIV prevention study, but instead what we're trying to understand is how all of these social structural stressors, the police brutality, the unemployment, the incarceration, and intersectional discrimination, we want to know how these are associated with substance use and mental health and physical health outcomes. And the intersectional part is the intersectional part is how do these individual level experiences reflect larger systems of interlocking structural inequality. But we're also interested in looking at these for men, they are all Black men, but at 2 key intersections. One is sexuality status. So the study includes heterosexual men, gay men, bisexual men, and other men who have sex with men. And we're also looking across intersections of socioeconomic status, so higher and lower status, because typically so much research uses this sort of single axis lens, just sort of one, it's just all Black men. But we know that there are different intersections and that Black men are not a monolith. And so we're trying to understand what can we learn about these different intersectional points related to Black men's experiences with stress and the outcomes of substance abuse. this is my excellent research team, David Shea, who is now at Tulane and brings to this study this focus on racism and the use of biomarkers, sort of in line with Nancy Krieger's notion, Nancy Krieger's eco-social theory about how people embody, like literally embody the effects of racism. Ana Maria Del Rio Gonzalez, who is our statistician and an amazing researcher in her own right. She does work mostly with undocumented Latinx trans women. Christopher Cannon with Whitman Walker Health, they are our community partner, and Gary Harper at University of Michigan School of Public Health. And so I just wanted to show you generally what it looks like to conceptualize something or a conceptual model intersectionally. These arrows show that we have different hypotheses for each of these groups. And we got a supplement where it's not reflected here, where we are looking specifically at bisexual men. And so this is a longitudinal study in which the men, and explanatory, explanatory sequential mixed methods design, where they take, fill out a quantitative survey, they do the biomarker measures. So we're collecting blood, urine for urine toxicology to get objective and subjective measures of substance use, height and weight, and several other things. And we're collecting them at two time points. And then we always want to know what's the good stuff, what's protective. And so we're looking at each of these we're looking at what's protected for each of these intersections. And this study is ongoing, as you might imagine, horribly disrupted by the pandemic, but we're back on track in terms of collecting data. So I don't have any data to share with you. So in closing, what does this all mean? What do I think about what's the sort of takeaway about all of this? One is that critical frameworks are just essential for this type of work, but training opportunities to learn them are rare. I think for me, so much of my background comes out of having done a master's in public policy with a concentration in women's studies. That's my timer telling me I'm at the end of time. And so that, and having done policy work, really sort of shapes why I think that these critical frameworks and why just focusing on individual level perspectives are really limited. But I say here, training opportunities are rare, and this was my chance to do my shameless plug of my Intersectionality Training Institute, which I've already done. And so I direct you to go and check it out, because we're doing all sorts of cool things. And what I really want to do with this institute is really build a community of researchers who are well trained in how to apply transformative approaches to really try and catalyze health equity. That's really the goal of the center. The other takeaway is this qualitative stance. And here I direct you to what Jean Marichek has written about qualitative research. I really rely on her work so heavily, because she talks about a qualitative stance. It's not just about the methods. It's a different way of working. And it's grounded in a different epistemology. And for me, one of the ways that shows up is recognizing that the Black men who participate in our work, they're the expert on their lives, and we follow their lead. That's how we get from doing work on condoms to police brutality. What is important to our participants, and what can finding out about their experiences, how can that shed light about, the outcomes we're interested in, and develop interventions that are likely to be much more effective than had we not focused on their experiences and really valued that they are the expert on their lives, not us. Another takeaway is the need for researchers to become structurally competent. This is a term, I just love this article. I always talk about this. This is an article by Metzel and Hansen. And this really, they are writing about it in the context of medical trainees and these sort of 5 areas of becoming structurally competent and going beyond these sort of cultural explanations for behaviors. Like, oh, Mrs. Johnson is late because, that's just how those people are, versus really understanding the structure research that explain why Mrs. Johnson is late. It's where she lives, transportation, again, these factors beyond the level of the individual. And so I'm currently writing a piece now, borrowing on this work as a foundation about what it means to become intersectionally, structurally competent. But I think this is really an important direction for critical health equity research. And last but not least, learning to prioritize transformative versus ameliorative approaches. This comes from the work in critical psychology. And so much of the way that at least psychologists, I know that other disciplines are better, approach a lot of work, like when we're talking about something like police brutality, is this ameliorative way, right? Which are approaches that seek to not ask any questions, don't disrupt the status quo, but work within a system. So for example, an ameliorative approach to police brutality would be making sure that people who are victims of police brutality get good counseling, mental health counseling, versus a transformative approach which says, wait a minute, there is something terribly wrong about a system, a country where police brutality is a daily, ongoing factor of what it means to be a Black or Black person or other person of color. And we need to transform those systems that facilitate oppression. And I'm not convinced that research in and of itself is going to get us there, but very important for us to start thinking about, okay, how can we do work that's transformative? And I will end there and invite your questions. Thank you.
I just wanted to thank you so much. And, we started this afternoon saying that I wish we were in person, and I really deeply wish we were in person, but grateful for just your scholarship and for your work
Thank you.
and your genuine approach to this work. So there are a few questions, and then we have some questions as well. And what we'll do maybe is I and Tyler, who's behind the scenes, are going to help kind of read out the questions, but there's one in the Q&A, and then we'll go ahead and get started there. So Olivia Baker asks, for someone interested in pursuing intersectionality research in graduate school, what advice do you have what advice do you have? Aside from addressing power and privilege, is there anything else you believe is important to address? And of course, you just mentioned this training institute, but I wonder.
Yeah, so check out the training institute, but beyond that, I think you should really be reading the original work on intersectionality. You should absolutely be reading Kimberly Crenshaw's work. You should absolutely be reading everything that Patricia Hill Collins has done. Starting with Black feminist thought. And so Kimberly Crenshaw's Mapping the Margins came out around like 1989, and Patricia Hill Collins's book, Black Feminist Thought, comes out at the same time. You won't find the word intersectionality in Patricia Hill Collins's book, but she's talking about the same thing. And so I find that, I also find anthologies like Audre Lorde. You'll see in anthologies like In the Life, Joseph Bean and Essex Hemphill, Black men, writing about intersectionality. Again, not talking about, you're not going to find that word, because I think so much of that earlier work really engaged with intersectionality as a social justice project. On our website, also under resources, we will be compiling, you'll see some there, different resources on intersectionality, and that's something that will grow. But I find that I see a lot of work, a lot of trouble when people are not familiar with the foundational stuff, the stuff that, Kimberly Crenshaw was talking about, structural intersectionality in her own work. And so somehow we end up over here with like multiple identities. But this is a really exciting time for people interested in intersectionality work, because there's just so much, rich work going on. So that's what I say.
That's super. And you have another question here also tied to, I think that we're all learners, but learners in the audience here asking if they're going to learn a little bit more about critical psychology, or if there's specific critical psychology graduate programs, where might they learn more?
Yeah, good. Let me know when you find it. I guess what comes closer is the work that they're doing, like Michelle Fine at CUNY. And I see that Michelle Fine and that group very much in the, very much in the arena of critical psychology work. But, Here, it's much harder. I mean, and clearly there are lots of us who are psychologists who are interested in racism and intersectionality, but we have not, you know, like I said, I just learned a few years, like, oh, this is what I've been doing all along. I didn't know. And I think that is also telling, right? Why is there this branch of this subfield of psychology that is focused on power and privilege and exposing relations, power relations, and saying that something is fundamentally wrong with a discipline that is just fine with oppression of people? And why don't we know about that? Like, why don't people know that there's a whole branch of this, that there are programs? That in of itself, I think, is telling.
Yeah, yeah. I was thinking when you're presenting that too, it's like we need a critical health services research, critical medicine, like, because it's exactly what you're saying, which is it's a way of being, right? It's a way of understanding this world through the lens of power. So I just really appreciate that. And someone here is saying, oh, I'm a critical public health academic. And so I think that does resonate with a lot of us here. We have a question from the audience with the hand raised. And so Tyler's going to go ahead and unmute Olivia for the question.
Hi there, are you able to hear me?
Yes, hi.
Hi, I'm so sorry I'm driving and calling in, but I really enjoyed this lecture. And I'm curious if you could just share what you think and also what the participants of your study think is the most transformative and important policy that could be implemented to support their livelihood.
God, that's a long list. Let's see, on my list would be things like universal health care, things like decarceration policies, voting rights. If you don't think that voting has anything to do with critical health equity, ask women in Texas and maybe in the whole country who will soon be seeking abortions. And so I think a lot in terms of like larger structural level reforms, many that are not likely to be implemented in my lifetime, but I believe that's where it's at. Policies such as those things like ban the box that prohibit employers about asking for criminal records. For example, at the time of an interview. And so this is what I mean when I talk about the need for researchers to become structurally competent, because those of us who come out of these sort of social science psych programs, I didn't learn about this stuff. I learned about the structural stuff doing HIV policy work or doing public policy. I learned how to do quantitative work. And I learned about a lot of those theories that I showed you, but I didn't learn about, okay, how do I look at structural racism and how that's operationalized in state laws, for example, and what might, how do I integrate that in terms of multi-level analyses to understand health outcomes? And so that's what I think it's really about, these larger structural level factors. Like in HIV, for example, a consistent finding is that Black men, particularly Black sexual minority men, engage in condom use in much higher rates than white men. They fewer sex partners. So engaging in the preventive behaviors that we educate about, but still that does not explain the inequitable rates of HIV incidence and prevalence. And so that tells us, wait a minute, it's not just this individual level what people are doing, or these larger systems and structures that shape and constrain health for people. So that's a lengthy answer, but that's what, did I answer your question, Olivia?
Yeah, you did. Thank you so much. If there's time, I'd love to ask a short follow-up question, but if there's not, I completely understand.
Yeah, go for it.
Go for it.
Great. So I do some work around creating safety in Baltimore using non-carceral solutions and not police-based solutions. And I often surprisingly encounter people who are at really high risk for experiencing police violence, who also are opposed to abolition and decarceration. I'm wondering if you experience that, and yeah, just what your thoughts are on that.
Yeah, no, I haven't. But again, remember, I'm coming at this through HIV prevention work. So that's not, we haven't, it's not like I'm a criminal justice reform researcher, or that's been a primary focus. This is what we learn when we talk to men. So I can't speak about what participants are saying, but I do find that I think that this type of community engagement work is where it's at, in terms of, like, you know, that tension of what communities think and what they're experiencing. I think for researchers who are doing this work, it really has to be done in concert with communities and their priorities and all of those tensions around, you know, the different viewpoints about things like abolition. So,
thank you so much.
you're welcome.
There's another question in the chat that I think also kind of springs from you know, your discussion of structural factors and really attending to those in your research. And so the comment is, you know, thank you for this wonderful talk, and in particular, the focus on transformative versus ameliorative approaches, and specifically really kind of honing in on how do we encourage more policy level application of transformative approaches. So, you know, even, and then they quote, like, the Surgeon General yesterday had a report on children's mental health crisis and can identify social and economic inequities, discrimination, and racism. And then the recommendations are individual or family level. So how is it that we kind of make this leap that you see in academia into the policy and practice?
Yeah, well, I think one of the things that's critically needed is, again, for researchers to be doing more structural work and publishing it. You know, as critical as I am about research, like I just get frustrated with research a lot, even though I love it. You know, like, oh my God, do we really need another study? Yeah, you do. You know why? Because policy, you know, if it's not written down, published somewhere, you know, it doesn't exist. And I learned this years ago when I was in graduate school, and it was when the unequal treatment report came out by the Institute of Medicine. And I remember they were doing all these different briefings, and I remember going to, and I was like, everybody knows this. Everybody knows that regardless of having access to insurance, that you're much more likely to be denied treatment, treated horribly in terms of access to health in the US if you're a person of color. And then I realized, like, why did they put this, they spent all this time in collecting this, but then that work was pivotal to informing policy reform. And so I think that's why research is important. But I think that researchers are feeding a lot of this stuff because it's easier to do individual level, you know, it's individual level measures. And so I think until the science develops more in terms of how do we do these sort of multi-level, and by multi-level I mean this integration of individual level and structural, I think we're always going to find ourselves in this position, because many researchers, structure is not the first place they go. The first place they go is, okay, I need a measure with this group, and that's where you know, it stays there. So that's my thought about that.
That's great. You know, I also see this kind of, I think, unique kind of feature in the work that you're doing. You presented the conceptual framework of 3 big studies, and we do this in our work too at SEICHE, which is both focusing on the structures, but also really kind of also focusing on assets and
yes,
neighborhood level assets. And this too is grounded in our participants, on, you know, people that live in those communities, to say there's too much work that is really focused on what's not working, what's broken, you know, apologizing folks. So I appreciate the frame shift in what I see in your work.
Always. Yeah, we want to know what's working, what's the good stuff, and conceptualizing. We do a lot in our work is conceptualizing. When we think about resilience, we don't think about resilience as an individual trait. We think about resources and factors that, in line with Ferguson Zimmerman's conceptualization of resilience, but resources and factors in the environment that allow people to, you know, to thrive despite oppression. And so, yeah, every study we do, we always make sure that we ask questions about, and participants really, in our experience, also really value that. You know, people aren't 100% oppressed all the time. People, there's joy, there's resilience, there's, you know, there's laughter, there's fun, and that's important to highlight. So thank you. I'm glad that you saw that.
Yeah, so I'm going to shift our conversation a little bit, and you touched on this talk, and so I had a question. I don't see any other questions in the chat, so there's two questions that I'll just push out there, which is the first is, you really do contextualize individuals within neighborhoods, and recently at Yale we had the researcher that designed kind of the area deprivation index, so Amy Kind speak. Where she's created kind of small area tract measures of deprivation using kind of trying to really characterize neighborhoods, right, at the most granular level. And she used the term intersectionality. So she uses this term to describe these interactions of embedding individuals within their neighborhoods as a way of understanding kind of, what I would say is different ways of kind of understanding individuals, persons, right, their identities, and also really trying to reflect on this attention to power, right, that certain neighborhoods do concentrate power, others don't. And so I wonder how you as an intersectional researcher might see that, and especially given, you're distinguishing individual identities versus position, in your talk. And so maybe more of a measurement idea, or if this is a flattening of that perspective. I just wonder what your thoughts are there.
Yeah, I mean, on something like that, I come into that completely through the lens of structure, right? Because the neighborhoods as constituted in the United States, those reflect a long legacy of federal government involvement, whether it's redlining, there are whole books written on this, on the color line. So we can't talk about neighborhoods in which people of color live in the US absent the legacy of slavery, the legacy of all of structural oppression and racism. And so I see that first and foremost. In terms of the whole thing about identities and positions, I'm very much shaped by Greta Bauer's work here. And so Greta talks about, the term identity is problematic for so many reasons. Number one, we don't always know how people identify. And racial group is a really good one of those, right? There's how people identify, and then there's this sort of Nancy Lopez's concept of meta perception or street race, because that's usually what's happening, that it's how other people perceive you as a person of color, regardless of how you may identify. Two, the problem with identities is that this notion that they are these sort of essential fixed things where, some identities that shift across the lifespan. And so I find that positions to be a much more sort of useful language, because it really focuses on how people are sort of, or attributions put on people, regardless of whether or not, or how they identify. And so that's all that's about. And then also Greta says in her work that focusing on identity solely sort of reinforces this notion of this sort of, that inequality is just, that's what we got, there's nothing we can do. Because then you're talking about the problem lying in the identity, like, oh, it's the people of color or marginalized identities. No, that's not the problem. It's the interlocking systems of oppression based on those identities. And so that's why I think it's important for us to get away from this identity-based version of intersectionality. I think it's getting us all focused, that's how we end up focusing on race instead of racism. The problem's not race, the problem is racism. And so that's what I mean by that. Did I answer your question?
Yeah, I do. I mean, it just strikes me though, is that still yet, if you're presenting kind of, again, in your latest study, categories by group, right? That you are looking at different gender identities or sexual identities, et cetera, and then stratified again by race categories, that they are still attributable to a person and less kind of a community, and you're not necessarily using intersectionality to define their place in that community, though I see researchers doing that. And so I wondered if that's pushing beyond kind of where you would define intersectionality, or how you might see that.
I don't think I understand, I think one of the things that we're doing in that study that's clear, so yeah, it is a very much an intra-categorical design, because we want to know, like, we want to know about Black men at different intersections. But what we're doing is asking about their specific experiences with inequality at these different intersections. And so it's not just, and so we're using an intersectional discrimination index measure, for example. And so it's really trying to understand what these experiences are and how they relate back to the individual person. Does that make sense?
Yeah.
So we're not just, so what I'm saying is, we're not just making inferences based on, oh, okay, these are Black gay men and these are Black heterosexual men. We expect that those who report more experiences of unemployment, incarceration, whatever, that their outcomes, regardless of whatever their intersection is, will likely be worse than those who don't report those experiences. And it's really about having measures to assess those rather than making inferences based on the intersectional positions.
Yes, and actually that was probably the clearest explanation. I think that does answer at least my own question.
Oh, good, good.
Because
yes.
I do think it's having that framework where you're both measuring kind of, again, these categories and also how they intersect with structures. That is the kind of intersectional nature of your analyses, which is different than where I see some researchers, and again, not just Professor Kind, I mean, I didn't expound upon this with her, but really even just doing a clustered analysis where you see individuals within, a certain neighborhood and then calling it intersectional, and that is different. And
that's right.
Yes.
That's right.
Yeah. So that's a distinction. That's clear.
Yeah.
One follow-up question that I might have is, I also have seen some researchers looking at kind of, again, criminal record as kind of these categories of having had the carceral experience and actually having been incarcerated as also a component of that intersectional, well, they're using identities, but maybe you would use position. And I wonder if you've seen that work, or maybe you just define that as a structure that intersects with these categories.
I see that as a structure. And I think that one of the things that I'm thinking about and writing about now is the need for researchers to, particularly those doing secondary data analysis with these large national data sets that aren't going to ask questions about, they're not going to have a police avoidance measure. But for us to see these demographic variables as, in fact, structural proxies for structural inequality. You got a sample with, and you have a sample, multi-ethnic sample, and you find that, 65% of the Black men report experiences of incarceration, or that's structure. That's structure. And so this is what I mean about researchers becoming more conversant in sort of this learning how to become more conversant about how to explain structure in their work, even if they're just using individual level measures. It's so important. Oh, wait, you're on mute.
Oh, I was just trying to see in terms of if there were any more questions in the chat, and I don't think that there are. So maybe one of the things that I'll end with here, our time together, is, given kind of this really just beautiful career, and forward looking at the intersectionality centers that you've launched, what areas of research within the criminal legal system, that is what we're focused on here, and health, do you see as holding the most promise or deserving of attention? You started as an HIV researcher, but now you've squarely moved into, you don't study criminal justice reform, and yet that is what a lot of your participants are talking about. So I just wonder, what do you see holding the most promise or deserving the most attention? What's absent in this dialogue?
I think that work on the collateral consequences of incarceration is really important in terms of how the impact of it on entire families. I see it as very much a continuum. I think that when most people think about criminal justice, people think like, oh, well, they must have done something, and that it's only a criminal justice. And I see it very much on that continuum where, Black people minding their own business And here come the police and all of the things that can happen, how you can lose your job, how you have to take time to go to court for something that, you know, that's a system level factor. And so I'm very much interested on us understanding the way that police brutality or the criminal justice system shapes the lives and health outcomes of people of color in the US at pretty much every juncture. It's not just about being shocked, although that fear, that's a very real fear, and I understand that as well. And so I think I want to see research that really shows this larger continuum beyond just what happens when you end up in the, you know, in a jail or prison or in a courtroom. That's what I'm thinking. Let's see what else. Oh, and I think there's really an important need for us for researchers to somehow collaborate more with community-based organizations and grassroots advocacy. We're not going to solve this just through research. And so it's really about community-based groups that care about these communities, have been doing this work for a long time. How can researchers better engage with those communities to advance their work and advance structural reform? Because I think the policies reform is not necessarily going to come through research. It's going to be advocacy that's going to do it. Those are my thoughts on that.
That's great. That's great. You know, I just wanted to thank you again for your time here and really appreciate this conversation. Again, just as a reminder for everyone to check out the new website that is in the chat, and we'll send that out to kind of all participants. And then also a reminder to register for our last talk for Bridget Davis on December 15th. But thank you so very much. I really appreciate this. It's been hugely growing and an honor to be in conversation.
Oh, I'm just delighted. It was my pleasure. Thank you so much for the invitation. Bye-bye, everyone.
Bye.